my name is Camilla. I'm a student nurse, and today I'm going to be doing a chest tube dressing change. So I have already checked my doctor's order, and Miss Linda Clark has an order for her chest tube dressing to be changed today. So I have already gathered my supplies, and I'm ready to enter my patient's bedside. So before I enter the room, I'm going to be doing my hand hygiene. And I'm also doing my safety check, so my patient is not in distress, the collarbone is in reach, and that the bed is in the lowest height. And now I'm going to introduce myself to my patient. So hi Miss Linda, my name is Camilla, I'm a student nurse, and I'm going to be changing your chest tube dressing today. So I'm just going to check your armband here. And could you please state your first and last name for me, your birthday, and do you have any allergies? No? Okay. So I'm going to set down my supplies, but before I do that, I'm just going to clean the table. And this is just garbage here. And in real life, I would be adjusting my table and my bed to my waist height. And I'm also going to make sure that my patient is in a semi-Fowler's position. I'm going to explain what I'm going to do. So Miss Linda, you do have a chest tube, and today I'm going to be changing the dressing for it. So I'm going to be removing the old dressing, I'm going to be assessing the site and also as well as cleaning the site. And I'm also going to put in a new dressing, which I have here. Do you have any questions for me? No? Okay. Are you still okay to receive this procedure? Yes, perfect. So before I open my sterile tray, I'm just going to make sure that my tube has no kinks and that it is draining well, which it is. Okay, and now that's good. I'm gonna go ahead and do my hand hygiene again. And I'm going to open my sterile tray. Okay, I'm just going to grab my tray, pass it to myself. Okay, I'm also going to grab my garbage, passing it to myself. Okay, now I'm going to add my supplies, and since I have been using my supplies, it is already open, but in real life it would all be closed. So I have my brain sponges here, making sure that it doesn't flip back. And this can just go in the garbage. I have my 4x4. I also have my jello net. And this can just go in the garbage as well. Now I'm going to add my normal saline in. Now I'm ready to remove my old dressing, but I'm just going to put on gloves. Okay. Miss Linda, I'm going to be removing your old dressing now. Okay. So I'm just going to make sure that I don't hurt my patient while doing this. We also want to make sure that we don't use any scissors in it. And I'm also just going to stabilize my tube to make sure that it doesn't get pulled out. Okay, and when I'm removing it, I'm also going to be assessing my old dressing to make sure that there is no drainage and where there isn't. So I can just throw this in the garbage now. Now I'm going to be removing my gloves. Just do my hand hygiene. I'm going to grab my forceps and remove my jello net. Okay, this is just garbage as well. And while I do that, I'm gonna assess my site as well, so I can see that there is no redness, the perineum skin looks intact, there is no drainage, which is good, and also I can see that no foul odor, no purulent drainage again, so that means there's no infection, which is good. Now I can go ahead and clean my wound. So I'm just gonna grab my sterile gloves, and since I don't have any space on my table, I'm gonna be doing it on my bedside here. And now since I am sterile, I'm gonna be, I can touch everything in my sterile tray. So I'm just going to grab my forceps here. Now I'm going to grab my 2x2s and make our set. Okay, Miss Linda, I'm gonna be cleaning your wound now. Making sure it's in a 360. This is just garbage. Making another rosette. Cleaning the outer part. Again, 360 and using a one side per wipe method. One more. Cleaning the outer again, 360. Garbage. Now I'm going to be cleaning my tube. And the one under. Garbage. And now I'm going to use my 4x4 and dry my site. And as you can see, there may be spots that it looks like it's wet, but it isn't. It is my Jello net. It looks like it's wet, but it's like the petroleum on it because I've been reusing my supplies. Okay, and now I'm going to dry my wound in a 360. Garbage. And I'm going to clean the outer part now. Again, 360. Garbage. And since my tube has already been dried, it has dried itself, I'm going to grab my Jello net and put it in. I'm just going to twist it. Okay, I'm going to grab my drain sponges and making sure that it is in 2 different directions. Okay, I'm going to grab my 4x4 now. And lastly, I'm going to grab my Mefix, which I have already cut beforehand, and I've also labeled it with my initials, like the date and the time. I'm just gonna okay. Okay, I have another one. And when I do this, I'm going to make sure that I kink under to make a tent under. Make sure that my chest tube is intact and that it won't get pulled out. Okay, I'm just gonna make sure that everything sticks well. Okay. Okay, and now that I've done my chest tube dressing, I'm just gonna clean my bedside and I'm gonna remove my gloves here. Again, I'm gonna do my hand hygiene. I'm going to make sure that I put my bed on the lowest height, and I'm going to ask my patient, Miss Linda, is there anything else I can do for you? No? Perfect. So while I'll leave the room, I'm going to be doing my safety check again, so my patient is not in distress, the call is in reach, and the bed is in the lowest height. And when I leave the room, I'm going to document that I did a chest tube dressing change. So I'm going to document what I did. So what I did was remove that old dressing, which has the Jello net, two drain sponges, one 4x4 and Mefix. I'm also going to say that it doesn't have any drainage. I'm also going to put in that I assessed the site and I cleaned it, that the site has no infection, the perineum skin looks healthy, there is no redness, and that there is no drainage. I'm also going to put in that I cleaned it with normal saline and that I put in new dressing, which is a Jello net, 2 IV drain sponges, 4x4s, and Mefix. That's it.